Members, I'd like to call this meeting to order on April 3rd, Health and Human Service Finance Committee. And today, we do have a quorum already established. So I need approval of the minutes. Is there someone who would like to approve the minutes of March 21st? So moved. Representative Liebling has moved the minutes of March 21st, 2013. Are there any changes or concerns to those minutes?
Seeing none.
Seeing none. All those in favor signify by saying aye. Aye. Any opposed? Okay, the minutes have been passed. We have before us House File 1233, Representative Huntley, and if you'd like to move your bill.
Madam Chair and members, I would like to move House File 1233 be heard and laid over for possible inclusion in the, delayed over because this will be, 1233 will be the bill that goes through.
Thank you. Representative Huntley has moved House File 1233, and I believe there's also a tiny author's amendment. Representative Huntley.
Okay, members and Madam Chair, we've been through this, the original bill, once already. And what we have as amendments are changes to the original bill that reflect the supplemental budget that the governor has proposed after we got the February forecast. So what the amendments will do is get the bill in the form that the governor wants it. Okay, and then later on, this committee will do its work and change the governor's bill in about 2 weeks. Is that right, Lucy? Week and a half? Okay, and just so everybody understands that we're going to hear the children's part of this bill, let's see, where is that? Now, and then this evening we're going to hear the continuing care starting at 6 o'clock. And again, the amendments today simply get the bill in the order that the governor wants it. And everybody needs to understand, and probably shouldn't say this, but the governor is spending $170 million above base, and the target I've been given is $150 million below base, so that's $320 million difference out of about a $5 billion, well, it's for the biennium, it's $10 billion. Okay, so
Representative Huntley, are you moving?
I would move the A13-0268 amendment.
Okay, members, that's been moved, and Representative Gruenhagen, did you?
Yeah, thank you, Madam Chair. Just a quick question. I think I'm using the wrong mic here. Just a quick question for Representative Huntley. That $150 million reduction, is that in projected growth, or is that off the base of the last spending from the previous biennium?
Representative Huntley.
Madam Chair and Representative Gruenhagen, it's off the base from the current biennium.
So
it does not include inflation. It's a straight cut.
So basically, it's a real reduction then.
Absolutely, it is.
Oh, okay.
Thank you. So is there any further discussion as to the A13-0268 amendment?
We have Aaron Sullivan Sutton to explain it on it.
Could we vote on it? Or do you want to vote on it first, or would you rather explain it first? Or you want to explain it? Go ahead.
Okay, well, we would like to vote on it first, and then she can explain it.
All those in favor of the A13-0268 amendment signify by saying aye.
Aye.
Any opposed? The amendment passes. And so now, just before we go on, you also have in your packet the DD 1233, which is, so you can set aside the initial bill and the amendment we just passed and work off the DD 1233 document, which is the engrossed version of those two bills the bill and the amendment that we just passed. So just for ease in moving ahead. So,
One would ask.
Representative Huntley?
Madam Chair, this is an attempt by Tom Huntley to make sure that everybody that chops down trees and makes paper is employed in northeastern Minnesota.
I think we would agree with that. So this is an unofficial, the DD 1233 is an unofficial engrossment for us to work off of today just for ease of members. And so I think I just want to also mention that you have a couple other items in front of you. And for those of you who are looking for a spreadsheet, I wanted to make certain that you had kept the spreadsheet from our past meeting. If you do not have that in your saved file in your folders, there are extras on the card. And so if you'd let the page know if you need the spreadsheet, we do have those available for members. You also have an index which we'll work off of, and an update and some updated change pages. So you have a lot of paper in your folders. Representative Loeffler.
Thank you, Madam Chair. And I'm just wondering, this is a really lovely guide, the Minnesota Department of Human Services Budget Bill Index, but it says as introduced, so are we going to need to get a new updated version now that we just adopted an amendment that makes changes? It would be really helpful if we need to, if they would do that.
I believe they will do it, but it has not been done yet. An updated version? An updated. Right. So, Representative Huntley, I think what we'll do now that everybody, and if anyone needs anything from the pages, please just indicate to the page what you're missing or you would like to have, and we'll get it for you. And in the meantime, Representative Huntley, and I'm going to suggest folks get the Minnesota Department of Human Services. It's a one-pager, and that'll kind of, I think, show where we're going to start. Representative Huntley, is that correct?
That's correct.
Okay, so grab that, and that'll be what we're going to walk through right now with the department. And so, Representative Huntley, if you and the department would like to continue walking through the bill, that would be great.
Okay.
Madam Chair, members, my name is Erin Sullivan Sutton. I'm the Assistant Commissioner for Children and Family Services at the department. And before I start, I should mention that the proposals in this area are focused on three primary things. One is an attempt to bring stability and hope to children in high-risk situations. Secondly, we're looking for smarter, streamlined services. And third, we're also responding to the reality of a 30% increase since 2007 in the number of children in poverty. We do that in a couple of ways. In terms of bringing stability to high-risk situations, you'll hear me talk about the North Star proposal. Also focus on emphasis for providing more opportunity for children of low-income families to have access to high-quality child care, and also some early intervention work to prevent children from being abused and neglected. In terms of smarter, streamlined services, we're focusing on a couple of areas primarily, rate consolidation in the child care area and some work in the Minnesota Family Investment Program. And then in terms of addressing the situation with the increase in number of children in poverty, we're really looking again at our MFIT program as well as in the governor's supplemental budget. He has recommendations for funding to prevent youth homelessness and to restore funding to the family assets of independence. With that, I'm also going to refer to the budget packet that you have before you, I believe, and just very quickly mention to you a couple of things. Starting on page 60, there are the first 4 pages in the children's area have had slight revisions from when the budget was originally proposed, primarily due to forecast changes or technical corrections. So those that had slight revisions are the one section of Reform 2020, which you'll hear more about tonight, but this has to do with a more on GRA who would be receiving housing stability services. The second change page that has slight changes on page 62, increasing access to high-quality care for children with high needs. And the next page, North Star Care for Children, was slightly revised, and then rebuilding an effective MFIT program was slightly revised.
Ms. Sutton, could you repeat what was the last one, please?
Rebuilding an effective MFIT program, and that is on page 66, and I'll talk more about that. There were no changes to the governor's recommendations with respect to expanding the Parent Support Outreach Program that you heard about earlier from me. The proposal to eliminate the electronic benefit transaction fee, the adoption assistance forecast, or match supportive services. So what I'd like to do this morning is just not repeat the testimony I gave you earlier on the governor's original budget, but refresh your recollection of the items in the bill related to child care, North Star, MFIP, and parent support outreach, and then spend some time on the new proposals with respect to FAME, child care savings as a result of all-day kindergarten, and the youth homeless prevention program. So the first area of the bill, I should mention, the children's area is in Article 3 of the bill. The first 10 sections of the Article 3 have to do with child care, as does Section 24. In the area of child care, we're working to ensure that parents with low incomes have increased access to high-quality child care. As you know, many children are entering kindergarten not fully prepared to do that, and to do that successfully. So we're really working to try to provide opportunities for low-income children to have access to high-quality care.
And Ms. Sutton, could you reference the pages that on the bill or the section that you're talking about here if folks want to follow
Yes,
along?
it begins on page 104 of the unofficial engrossment.
Thank you.
We're also working to try to provide more stability and stable environments for these young children. So within sections 1 to 10, there are a number of things that are happening here. One, we're working to assure that teen parents who are pursuing their high school diploma or post-secondary education, high school diploma or GED, have access to child care. Currently, those individuals could be on the basic sliding fee program, and so we're recommending amendments to ensure that they have access to child care so that they can go to school. We're also making changes to the biannual survey rate to determine what is the 75th percentile for child care and moving to a cluster basis to simplify the child care rate structure that we currently have in place. And in simplifying the rate structure, we're also recommending higher rates for some providers. As you may know, the rates, the maximum rates that we've reimbursed for child care have been significantly reduced over the years. And so we're trying to simplify the rate structure and provide some slight increases.
And Ms. Sutton, is this going to affect people? Is this changing the number of people that might be on a waiting list to get involved, or just those that are already qualified and are receiving services?
This is for those that are already qualified and receiving child care services under MFIP, as well as then the basic sliding fee rate structure.
And am I correct in assuming there is a waiting list for these services?
There is a waiting list for the basic sliding fee, but for families who are on MFIP, there is not a waiting list.
Okay, thank you. Representative Loeffler.
Thank you, Madam Chair, and Assistant Commissioner Sutton-Sullivan. There's been a lot of discussion, and I believe the governor is supporting as well the concept of the scholarships for early childhood quality preschool. And I'm not sure how those two initiatives interact. My understanding is that the scholarship is not a sliding fee like our basic sliding fee. Can you tell us how that's potentially going to interact, particularly for those thousands of families that are on the waiting list?
Sutton.
Sure, Madam Chair, Representative. Both the scholarships and the governor's proposal in the child care program are attempting to direct low-income kids to high-quality care. So, for example, in the bill that you have before you, there's a recommendation that we would provide for a 15% rate differential for child care programs who have a 3-star rating under our Quality Improvement Parent Aware system, and 20% differential for the 4-star rating program. And under the scholarships, my understanding from the Department of Education's proposal is that they would direct scholarships to be used to help parents access high-quality care programs. And families may, in fact, end up accessing child care as well as scholarships, and braid the two together in order to pay for a full-time slotting program.
Representative Loeffler, do you have a follow-up?
Thank you, Madam Chair, and that still makes it even more confusing, because it sounds like we'll have two different systems for parents to apply to. They may be on the waiting list right now for basic sliding fee, but then they would have to apply to the Department of Ed, and they could actually double up while we still have thousands waiting. I'm still trying to understand how do we integrate the changes in these two programs.
I think that's a great question. It looks like we have some help maybe for this.
Yeah. Madam Chair,
If you'd identify yourself, please.
Yes. Madam Chair, members of the committee, my name is Mary Orr with the Department of Human Services. And Representative Loeffler, we view scholarships and the Child Care Assistance Program and the changes the governor's proposing as being complementary. Right now, the cost of childcare and the current market rates is such that the combination of child care assistance and the rates that we pay for child care assistance does not fully reimburse what a provider charges, and so scholarships can make up that difference that would otherwise be paid for by parents. The difference between what a provider charges, what the child care assistance pays as a maximum rate. That difference scholarships can be used to pay that difference. Scholarships could also be used in counties where there is a basic sliding fee waiting list and the child care assistance funding isn't available. A scholarship could be used for a low-income family to access child care. There are other situations where there are co-pays and things that would otherwise be paid for by a family where scholarships could be used. So we would view these as complementary ways of helping families access child care.
And I think Representative Loeffler and I think, getting at some of the same concern is that there is a waiting list, there are people out there, and is there a way to maximize this? I understand the complementary for a family is useful, but it also isn't getting at getting people that qualify, more people qualify, the help that they might need. And so I think we're both concerned that, and maybe others too would share this, that there's a fine line between giving a person more money and giving more people less money that we hope you'll think about as you move forward. And I know Representative Abler has a question too. Representative Loeffler?
Well, thank you. And Ms. Orr, perhaps you didn't hear my question. My question was from the family perspective and the administration perspective. You know, we have 6,000 people on the waiting list already. Are they supposed to find out about the scholarship program and then apply for that as well? Is it going to be integrated so everyone who's on the waiting list is considered for a scholarship? I think, is there any oversight about doubling up so somebody gets to win the lottery and they don't have any cost because they have both programs, while another 1,000 people still don't have anything? I mean, that's where we're trying to understand the integration, not the complementary, like, hey, you can double up. It's like, hey, we've got a lot of people with needs, and how are they going to get into these two streams, and are they administratively integrated?
And Representative Loeffler, we're going to have the department answer. I have 3 people on the list, I think, still on this topic, but we do want to keep moving through the bill. So I think we're raising issues perhaps for the departments to think about, and Representative Huntley, too, as the author of the bill, as we move ahead. Would either of you like to address that quickly?
I would. Thanks, Madam Chair and Representative. We're working very closely with the Department of Ed under the auspices of the Office of Early Learning to provide coordinated instructions to those entities administering the scholarships and providing guidance on how to mix and match so that people aren't double dipping, but rather that the funds are used in a way that makes sense and upholds the integrity of the program. We're also working with the grant administrators of the scholarships on outreach efforts so that we can reach those low-income families, particularly those on the waiting list that we would like to have access to the program.
Thank you. Representative Abler.
Oh, thanks. Just a comment. This is a $23 million item, so maybe your questions are moot. But I had just had 2 process questions. Was this whole child care section vetted in the Early Childhood Committee? That was heard down there.
Madam Chair, yes, my understanding is it did go before Representative Muller.
Oh, good. And
Representative Abler.
yeah, and thanks. And there's a bunch of new policy stuff in here, which I know we didn't do in the policy committee, but I'll just save my questions when those come up. Thank you.
Okay. Representative Dean.
Thank you, Madam Chair and Representative Huntley. Just a point of process for walking through the bill, just to try to get through the bill in a timely fashion today. Are we going to be focusing primarily today on changes from the previously described sections, and then also secondarily, if we're going to vote the bill out today, you kind of talked a little bit about process for coming back for next week. Can you just maybe clarify that a little bit?
Representative Huntley.
Madam Chair and Representative Dean, it's my intent, we've already gone through the spreadsheet of the original bill. with the governor's proposal. And my intent today is to spend most of the time on the changes to that original spreadsheet that we saw 2 months ago, and try to get through that today and tonight. In terms of we have a few more bills we're going to hear, and then I will present basically an amendment to this one we're working with right now, and present that to the committee, and that will then be open for all kinds of amendments. And I'll get it to you a number of days. I don't know how many, Lucy, 2 days before we would have to start actually moving on the bill.
And it sounds like that'll be next week, Representative Huntley.
Yeah.
Representative, thank you. And we are right now going through those changes, and while we are discussing some policy here, this is a revision to the current, which is why we're discussing it. And I think we have 2 more questions, Representative Newton and Hartman.
Yes, thank you, Madam Chair. On the child care component that you're talking about, is that the educational component of that? Are you looking at the Mini Minds program also that the governor has proposed for the Department of Education? It's something like $20 million, I believe.
Madam Chair, Representative, that is the scholarships that is part of the governor's proposal in the education budget.
And Madam Chair, to follow up on that, how is this related? Because it's being carried in the Department of Education budget and in this one as well?
Ms. Sutton?
Madam Chair, Representative, the Department of Education budget includes funding for the scholarships that were referenced earlier, and the Human Services budget has funding for child care programs for people who are eligible because of the need for child care so that they can go to work, or people who have recently left our public programs, or people who are working poor on the basic sliding fee program.
Thank you.
Representative Portman?
Thank you. I think what might be helpful to get at Representative Loeffler's question is some hypotheticals for certain families that would qualify for both child care assistance and the early learning scholarships, of how that would work. I know when I had little kids in daycare, they were at Montessori all day, but only a part of it was preschool. And so if you could just give us some 4 examples of low-income families and then sliding scale families and how they might access and use these programs, that would probably be helpful.
And Representative Portman, are you asking for this in the future, or do you want them to talk about it right now?
Oh, well, I think we got to get through the bill, so maybe.
Madam Chair, Representative, we do have some examples worked up that we'd be happy to share with the committee.
Wonderful, thank
Thank
you.
you.
Representative Huntley and Ms. Sutton, if you'd like to continue.
Madam Chair, there are 2 other provisions I want to mention with respect to the child care. One is to the recommendation to allow for a 30-day reinstatement period for families served by the basic sliding fee to get their paperwork so we don't have disruption for children in care. And then Section 24 of the bill changes the disqualification periods with child care to be consistent with other human service programs. The next area of the proposal that I want to talk just briefly about, I did talk to the committee in the past, is the North Star Care for Children. And as you can see on the one-page handout, it's a fairly large section of Article 3. To remind you of what this does, is currently we have 3 separate programs to support children in out-of-home care. We have foster care. For children in temporary care, we have relative custody assistance, which is provided to relatives who assume permanent legal responsibility for children, and we have adoption assistance to help adoptive parents who adopt special needs children. They are 3 separate programs, and they have different benefit levels. And in fact, when foster families, are asked to adopt or accept permanent responsibility for children, the assistance available to them is about half or less than half of what they get as foster care. So the recommendation that the governor has is to propose a new program called North Star Care for Children that would start January 1st of 2015. and that would apply for kids who are coming into the system after that time, so that no changes would be made for children who are currently out in out-of-home care unless their placement situation would change. This is the third time you've seen something called North Star. I should mention, though, this has changed over the past couple of years through the assistance and feedback that we've got from numerous stakeholders around the state. And we've worked to try to address their concerns, which is part of the reason you have an implementation date into the future. The governor's proposal consolidates and simplifies the administration of these three existing programs and seeks to create level rates to establish equity across the program. There's one exception to that. The new North Star rate and consistency would apply for children who are 6 and over as they move to permanency, and younger children who move to permanency through adoption would continue to get a lower rate. And the reason for that is that because we're pretty successful in seeing little children adopted, it's children who become older, particularly the ages of 7 to 8, and in their teenage years are much more difficult to find permanent adoptive families. And what we hear oftentimes is for a number of foster parents, they would like to be able to adopt but are not able to afford it. And as you can imagine, these kids who've been in the foster care system have experienced a lot of trauma, and they need additional support as they move permanently with families. The new program would create a basic monthly payment rate based on the children's age that could be supplemented with some supplemental needs. There's actually 10 levels that are in the program. And there would be a uniform assessment that would follow the child across their legal status as opposed to 3 separate assessment processes. As I mentioned, children in all the programs would be grandfathered under the current program unless they were specifically transitioned into North Star Care for Children. One of the things that we're very interested in is we continue to have a disproportionate number of African American and American Indian children in out-of-home care, and in fact the payment disparity disproportionately impacts African American and American Indian children, who make up almost 40% of the children who remain in care for a year or longer. This also would provide assistance to sibling groups who we would like to see move into permanent families together and not have to be separated. The operations of the programs would be similar to what we have today. It would be seamless from the parent's perspective. We would be restructuring RCA, Relative Custody Assistance Program, from a means-tested program to guardianship assistance, which allows us to bring down Title IV dollars that were provided by Congress through the Fostering Connections Act a couple of years, and we would no longer rely on TANF funding. And the new guardianship assistance program would be operated similar to the adoption assistance program in that there's an initial role for the part of counties as well as a state role, and as I mentioned, a common assessment process. The other thing I should mention is that the cost of care across these programs would be a shared responsibility of the counties, the state, as well as the federal government through Title IV. And we've worked with the counties to assure that that it's a shared responsibility and that they're not at risk for increases in the cost. So that's kind of the high-level summary of that proposal. If there's not any questions, the other area I will move to, is just to refresh your recollection, is rebuilding an effective MFIP program. And these sections are sections 25, 27, 29, and 32. We're hoping to improve program outcomes in the Minnesota Family Investment Program by simplifying administration and targeting resources. One, to establish home visiting for teens. This is a proposal that's complementary to the other child care proposal. We really want to focus on helping to assure teens have access to high-quality care, but also that their needs are met, and we're helping to work with them through home visiting in the Department of Health. We're also looking to renew our investment in supporting strong employment outcomes for families on MFIP. Well, one way we do that is by increasing the income disregard to 50% of gross earned income. That would be comparable to how that's handled in the unemployment insurance program. As a part of that, we would also suspend the work benefit, which is actually a whole separate program that people move on to when they leave MFIP, where we give people $25 a month. And so we would balance that by increasing the earned income disregard. We think that's a smarter and more streamlined way to operate this program. We also would like to modify the TANF performance funds distribution to be based on people going to work and the self-support index, which is consistent with our hope to be able to pursue a federal TANF demonstration or federal waiver to allow us to move from the process measure of the work participation rates to really measuring people who get to work through the self-support index. And there's a section in here that would allow the commissioner the opportunity to pursue a federal demonstration. We also want to focus on whether people are moving to work 3 years after they've been on the program, as well as people who are working 30 more hours per week. And there's also some recommendations here to provide resources to try to address the disparities in outcomes for African American and American Indian individuals on the program, as well as investments for work study and paid work experience. With that, I'd like to turn to...
we have a question, Representative Loeffler.
Thank you, Madam Chair and Assistant Commissioner Sullivan-Sutton. On the suspending the work benefit, which is after people go off the program, does that really, I mean, that's the only incentive, quite honestly, for anyone to tell us they've got a job at that level and to have those success rates in terms of our work participation and knowing who's gotten into stable employment. It's been really hard to ever be able to follow up on people because they tend to just drop up and disappear. They're delighted to be out of the system. And, you know, that little bit of incentive actually lets us know how we're doing. And have you, weighed the loss of that kind of quality outcome information?
Ms. Sutton.
I mean, even for the first month after they're off, it's an incentive for them to let us know, hey, I got a
Ms.
job.
Sutton.
And
Representative Loeffler, Madam Chair, we certainly do want to know what happens to people and how they move to employment. One of the things that we'll be looking to do if we're able to pursue a waiver is to negotiate with the federal government on how we will be able to determine the outcomes and people getting to work. We think that administrating a separate program is not as efficient as we can be in trying to move people to employment, but we do want to focus on outcomes and making sure that people are moving to work. So that will be part of the things that we look at.
thank you.
Are there any other questions before we move on? Okay.
Okay, with that, I'd like to turn to the three due budget items. I'm back to the budget document on page 120. The governor recommends that $500,000 for the biennium be invested in the Family Assets for Independence program, beginning in fiscal year 2014. The FAME program provides match savings to low-income workers to help them build assets. To be eligible, people have to have an income below 200% of poverty and assets of less than $10,000. The individual savings are matched through federal funds as well as possibly private funds, and the savings can be used by the individual to help them with home ownership, post-secondary education, or small business development. This has been a small program, but a very successful program that's been used by low-income people to help get them out of poverty. And this was funded initially in 1998 at a $500,000 per the biennium, and over time that has been reduced, and then it was eliminated at one point, and there was one-time TANF funding. So this would restore the program the way it was originally.
And members, I'm just going to point out, if you'll look at this Minnesota Department of Human Services detailed budget changes packet, so it's one of your many piles, it's on page 120 of that. And I think the next few programs will follow right after that, if you want to look at your book.
Okay, on page 121 are the savings that we believe would accrue under the Child Care Assistance Program if all-day kindergarten is funded. As you know, the governor has recommended to increase spending in the Department of Education's budget for all-day kindergarten beginning in 2014. So we would expect to see an increase in participation of kindergarten students served in all-day, everyday programs from about 49% to about 85%. So this would result in savings in the MFIP child care program that you see before you.
And Ms. Sutton, just out of curiosity, what is the cost to do this at the other end? Is this budget neutral? Are we spending more on education than we're losing in Health and Human Services, if anyone has looked at that?
Madam Chair, my understanding is that the funding increase in the Department of Education is greater than the savings here.
Okay, thank you for that.
And then the last item is on page 124. And here the governor is recommending a $5 million appropriation, investing $5 million over the course of the biennium to address youth homelessness throughout the state and to try to prevent youth from becoming homeless. You may be familiar with the work that Wilder Research has done where they estimate that there's about 2,500 unaccompanied youth on any given day in Minnesota. Currently, we have $119,000 annually that provides services, and you can imagine there's a great need. We only have 108 emergency shelter beds and about 600 units of transitional living programs. And the governor is very concerned about this population. This would allow us to, across the state, to develop a much richer continuum of services to support these at-risk youth and to prevent their homelessness.
And I don't see any hand up, so I'm going to ask my question too. And one of the, we heard several very compelling bills in this area. I think Representative Moran had one of them and some others, Representative Allen, I think, had one, maybe two, with safe harbors, which is a little different, but they're also homeless youth. Has the department or the governor considered both of those populations in this proposal? Is it only dealing with one? Can you address that at all?
My understanding is this is focused primarily on the homeless youth population. However, I think that a number of the children who are the subject of the conversations in Safe Harbor, there's some overlap there.
And I would just say part of the real compelling testimony we heard from the folks, particularly on the Safe Harbor legislation, or the bill on safe harbors, talked about specific and different needs perhaps that population has, and it sounds like that isn't being addressed in this. It's just focused at homelessness in general.
That's correct.
Yeah. So, just for committee members, we did hear several long, bills about that, and we'll probably deal with that as we move ahead and Representative Huntley's amendments, hopefully. Do you have further?
So that's it for the children and families area.
Were there other questions, members? Okay. Representative Huntley, where do you want to go from here? Representative Labeling.
Thank you. Sorry, Madam Chair. Ms. Sullivan-Sutton, can you just make it really clear for me what's happening budgetarily with the TANF funding versus other funds here? Are we moving some things out of the TANF funds, or is nothing happening in that regard?
Madam Chair, Representative, there's nothing happening with respect to moving funds out of the TANF fund.
Ms. Liebling, Representative Liebling. You're still a Ms.
Thanks, Madam Chair. Well, what about the other direction? I mean, are we freeing up TANF funds, or we're just not making any changes in either direction?
Madam Chair, Representative.
Could you read your name into the microphone, please, so we can identify you?
Madam Chair, Representative, my name is Jenny Ernst, Department of Human Services. There are no changes to the TANF fund in this budget proposal.
Representative Liebling? Okay. Representative Abler.
Thanks, and I'm sorry I had to step out. I like your TANF question. So just to clarify, I'll help focus on this. So I understand the TANF reserve gets spent down to zero, but are those all normal TANF expenses that it's spent on, or is there any, there's different euphemisms for refinancing, but is there any of non-traditional TANF uses that are being used for TANF in the bill?
As of the February forecast, the balance at the end of fiscal year 15 is zero. You're correct. We can provide the committee with a document that will show exactly where all the TANF funds are spent with the description. They're spent with the MFIP cash program. Some funds are transferred to the Child Care Assistance Program. There are some funds that are used for administrative purposes to provide oversight of the program, but we can provide that detail.
All right, Madam Chair.
Representative Abler.
So I think that it's safe to say that, I mean, there's difference of opinion about why you would refinance it sometimes, but it sounds like it's all in the category of what people think of as TANF and admin and all that. Is that fair? Is that?
Madam Chair, Representative, would you repeat the
I'm
question?
not sure who, yeah, there was a question, and who would you like to answer, Representative?
Well, I'm just trying to restate it just so we get that question solved. You might find yourself doing something else with TANF, Madam Chair. But the governor doesn't, it's all for TANF-related purposes. There's no, I think in my budget, we refinanced some TANF in 2011 and converted the general fund to buy something else. That doesn't happen in this budget at all, is that right?
That's correct, Madam
Okay.
Chair, Representative.
Thank you.
I have Representative Lane first, and then Representative Leadley.
Thank you, Madam Chair. You had said that with all-day kindergarten to save money in MFIB childcare, but wouldn't there be savings in other kinds of the childcare?
Ms. Sutton-Sullivan.
Madam Chair, Representative Lane, we don't believe that there would be savings in the basic sliding fee program, in part because we have waiting lists that were mentioned.
Thank you.
Representative Leadley, did you have a follow-up?
Well, yeah, thank you, Madam Chair, and really more of a comment, I guess, to Representative Abler, and I appreciate, too, that you're asking that question, bring that up. I don't think you're ever going to get anybody from the department to say that they're not using a fund for its intended purpose, whether, and, I take them at their word that they believe they're using it properly, but I think that whether it's really related to TANF is kind of for us to decide, and not really for them to decide. That's just my take on that.
Representative Loeffler.
Well, thank you, Madam Chair. And as Chair Huntley mentioned it early at the beginning of this meeting, we have a really daunting task in front of this group in terms of our budget target. And so it's really important that as we weigh this, we get some historical data and trend line and where things are going up and that sort of thing. And I know this part of it was the new state budget system, but even this new handout that we have, the budget starts in fiscal year 14 on these pages. We have no information on current baseline or even the previous biennium. And as we're trying to identify areas, it would really be helpful for us if the department and its budget people could put together some information for us that shows, by area going back at least, it would be nice to go back even beyond the current biennium. So we get some trend line information, because it's really hard to get a feel for what's happening in the dynamics of these programs. We get a lot of information about the changes, but not so much about the base, and unfortunately we're challenged to look at a different place than we'd hoped to.
Thank you. Representative Newton.
Thank you, Madam Chair. Just a question, I'm not sure who can answer it, but you indicate there will be a savings in all-day kindergarten, but as a result of the Mini-Minds program that the governor is proposing for K-12 education, won't there also be a savings there for daycare? I think he's proposing something in the neighborhood of $20 million for that program, which is scholarships for daycare.
Excuse me.
Madam Chair, Representative, what we're showing here is the savings to the MFIP childcare program as a result if all-day kindergarten is funded. I don't have the figure or any knowledge as to whether the scholarship Mini-Minds proposal was adjusted based on all-day kindergarten.
Actually, that's a rather interesting thing to think about, and maybe we should inquire further both in the education department and others.
Yes, Madam Chair, yes, and I think we're primarily looking in Mini-Minds programs at 3- and 4-year-olds, so they're not eligible for kindergarten. But that has to be explored a little bit more, I think.
Thank you. Are there other questions, members? We could move on to the continuing care portion, except they're over in the Senate testifying and not able to be here right now. And so we're at the point that if we don't have questions about this particular section of the bill, I think we're going to have to adjourn early and come back this evening. And Representative Huntley, do you have anything else, or do you want to carry the bill yourself and not have the department here to help you?
Madam Chair, no, I don't wish to carry it myself.
I thought so.
And it would be very brief if I did.
It's a good bill. Vote for it. Isn't it?
But on the question of
Representative Huntley.
we're showing savings in the MFIP on child care. That's one of the more interesting things because there are other issues in other parts of the bill that relate to other departments. And the one I think most of us are aware of is taking people that are in corrections and putting them, when they go to a hospital and into medical assistance, that costs the Health and Human Services budget money, but it actually saves money in corrections. So we could have that fight with leadership as to who's going to really pay for some of those things. But we're getting savings here, and I want to keep that.
Hear, hear. Representative Abler, I think you had another question.
Well, yeah, at the risk of leaving early before we ask more questions. I asked kind of about the policy provisions earlier and just kind of paging through this new draft here. And the work of the Early Childhood Committee, there's a bunch of policy that's nothing to do with money and child care matters about car seats and shaking behaviors and all that, which, I'm against shaking behaviors. But was this ever heard in a policy committee to talk about this? And why would you put this in a budget bill? If this is not duplicated from elsewhere. That's my array of questions.
Madam Chair, Representative Abler, you're scheduled to hear testimony from Jerry Kerber on that on Friday. There is a budget proposal related to those provisions with respect to training and staffing in the licensing area. There's been, Representative Fritz has had a bill that was heard in Policy Committee on similar issues.
Madam Chair.
Representative Abler.
Okay, I just was surprised there's policy in a bill that, there's some money tied to some of this, but there's not money tied to every bit of this. And the reason I know this is I was talking to them about this stuff. Oh, that's in the budget bill. And I'm just to remind people, 2 years ago, I put policy in my budget bill. It was an emergency, and a woman who's unnamed wearing a red blazer had some concerns about the process by which I did that. And I believe the entire committee, including Representative Huntley, had concerns about that. So that was a time that was a crisis, and I didn't like the process either. This is not a crisis, and we're doing policy work and budget bills that may be controversial. But the question I want to ask was the content of all this policy about child care heard in the Early Childhood Committee and then voted out of there as that they approved it. That's my question. Did they have a chance to amend it and work on it since they're doing the work of that?
So, Ms. Sutton-Sullivan, I see you looking at the audience. I don't know if there's someone who can answer that, or if it was heard in Representative Liebling's committee, she may be able to answer that. I don't know who wants to. Representative Liebling had her hand up. You want to start?
Thank you, Madam Chair. And I just want to say that I don't remember that, but I agree with her. And I think a lot of this probably would be heard in Representative Mullery's committee rather than mine. But I do think that to the degree that some of the provisions might be pure policy, and I'm not sure exactly which ones you mean, but I appreciate your pointing them out, Representative Abler, that you did that, and I agree with you. I think that barring some special circumstance, we ought to, and we have policy committees for a reason, and we ought to be doing these things in policy. So
Representative Liebling, are you going to have a policy omnibus bill?
No, we don't have a policy omnibus bill this year. So, and obviously, we're past the deadline for policy. We'd have to probably, I don't know at this point, but, I don't know that we would go back. But I think it's a point worth raising.
It is, and I would say because we aren't having a omnibus policy bill, it does put us in the position of having to put policy somewhere, and I'm, which may be different than past years when we have had a policy bill. But if we don't have one and all policy is in the finance bill and it's been vetted through early childhood, that may take care of some of the concerns. But in a normal process, if we had a policy bill, I would say it should go to Representative Liebling's committee and be heard there. And I see Representative Lane and Representative Loeffler have comments.
Thank you, Madam Chair. I would just say that the early childhood doesn't have a policy bill this year either. So.
And Representative Lane, do you serve on that committee? And can you clarify for Representative Abler whether this bill has, any of these issues have come through there, or you don't recall? I'm putting you on the spot. I apologize.
Right. I've heard them. I can't recall where.
Okay. Thank you. Representative Loeffler.
Well, thank you, Madam Chair. On this particular issue, I can actually tell you that this was heard in Representative Liebling's policy committee, because I remember the discussion where I wanted to go back to shaken baby syndrome as opposed to traumatic head injury, because I said every time you read about it in a newspaper, you educate the public who may not know how fragile young babies are. And if you see traumatic brain injury, you think it was a car accident or something else. And so I know we did hear that one. But I am concerned because there are a lot of things that the department put into their budget bill that they did not, as I understand it, introduce as separate policy bills to even be considered for hearing. And if as they go through the budget, they could highlight those that they have not had a policy hearing on, I think that would be helpful both to the audience of stakeholders as well as us to understand which ones have gone through a policy committee and which ones haven't, because I think there's a mixture.
And Representative Quam has a question, but just part of that. Representative Liebling, can you tell me the bills that you heard through your policy committee, as we've heard here, the Shaken Baby did go through your committee in some form, at least Representative Loeffler believes it did. Did you forward those on then to Representative Huntley's committee, so they have had a hearing and been vetted and they're going to end up in these bills? Or what happened to the bills that you heard? Are they traveling on their own? Or where are the policy bills that you heard in your committee?
Well, Madam Chair, I mean, I can't recall from memory where every bill went and so on, but many of them, of course, came to this committee to be incorporated into the budget bill. But I think that Representative Loeffler's point is well taken. I think it would be very helpful to have some of this flagged if it did not go through a policy committee, so that we can be sure it gets the vetting that it deserves. And of course, we did hear Representative Fritz's bill on sleep position, but that was not anything related to some of these other issues that I assumed went through the Representative Mullery's committee, because they really didn't pertain to the jurisdiction of the HHS Policy Committee. But as I just want to speak for a second to this issue that Representative Loeffler brought up specifically about Shaken Baby. That is really a very controversial issue, and I just want to be on record as saying that I'm actually on the opposite side of that from Representative Loeffler for a lot of other reasons. But this really is an issue that should bear a lot of discussion. And, that kind of flags it for me that perhaps even after deadline, maybe we'll do something with that in the policy committee, because it's really an issue about what causes the injuries that have previously been identified as being caused by shaking. And I actually believe that it's entirely appropriate to stop using that language. So I know there's disagreement. This is controversial, and we probably should explore this further.
Thank you. Representative Quam.
Thank you, Madam Chair. And, not being a speed reader and having skimmed through the approximately 1,500 pages of material here, I'm not seeing a cross-reference of the bills that were utilized for the different sections, and that might assist us in the evaluation of what has or has not made it through hearings in other committees and to what extent. But that would be useful if I'm assuming that the drafters of this actually know what they took it from, and if they've got that, it might help us to determine, the question before us.
Representative Crum, I appreciate what you're saying, and I think this has been a healthy discussion, actually. But I think we need to remember this is the governor's budget, not our budget, and the bills that we have heard as legislators that came through either on their own or through Representative Mullery's committee or Representative Liebling's committee will be in that amended version that Representative Huntley referenced earlier when we come back and make changes to the governor's budget. So that process still is yet to be, and I do think it would be healthy for those bills to be flagged. And I think asking the department to tell us if some of this is policy only would be nice, and I think they heard that request, and I think we can assume that they're nodding their head that they'll address that. But I do think, Representative Huntley, do you want to speak to that at all?
Well, you are absolutely correct on that, and Ms. Morgan has the list of every bill and what the details of it were and what the finances are, and if they end up in a proposal to be put into the omnibus bill, they will be listed at that time.
Great. And did we have Representative Hortman and Representative Abler yet?
Just briefly, I want to add about the deadlines. People often say, well, we're past the policy deadlines. But remember that there is still a pathway for policy bills to move forward. It is through the Rules Committee. So it's not like we're done talking about policy this year. And the deadlines don't apply to policy that is within finance bills. and there's always some policy in finance bills. So I just think we have to understand that the policy deadlines doesn't mean that we're not talking about policy after those dates. It's just a different pathway that we talk about policy, and we shouldn't trip over process too much and not focus on the product, which is what we're all working on.
Thank you for pointing that out, Representative Hartman. And I think there's a few freshmen in here, but most of us understand custom and usage. And thank you for pointing that out, because that is how we do business here. Representative Abler?
Well, and thanks, and I couldn't agree more than with Representative Hartman about that. The product is the most important to me. I don't know this early childhood stuff. I was on the committee as a freshman, and I haven't been back. But we did, oversee it as part of our in and out of this committee over the years, different ways. But this was very controversial. If you remember, especially some of the Olmsted County people were very concerned. I got a lot of emails from your constituents, and they were very worried about some of these licensed home changes. And here they all are sitting here, and I don't think that Representative Mullery's ever sat through that. And maybe process be hanged, we should suggest that they reconvene that committee, at least vet this, and offer us an amendment they would suggest. Because I don't feel comfortable voting on checking on kids every 15 minutes or 30 minutes. I know that was really controversial to these families who are running these places, as an example, and there's not a penny of money tied to that. There's no bonus if they check or anything like that. So just as an example, that's on page 114. And so just out of regard for the product, and I can't think that wouldn't be good. And I think the people that are going to write us later are saying, why did you do this to us without a hearing? I mean, we can't possibly devise all the early childhood stuff in a hearing here. Well, maybe Representative Huntley wants to oversee, if this goes into his omnibus, he wants to have 3 hours on early childhood discussing sleep postures and all that, and how often to check. I kind of think he does, and I know his feeling. But that's my advice, and I think that maybe you want to talk to Representative Muller and see if he wants to reconvene that committee and go over all this stuff. Thank you.
Representative Abler, I would like to say that, to ask Ms. Sutton Sullivan if she knows the answer to this. But as I recall, at least in my community, Jerry Kerber traveled around the state and discussed many of these issues with stakeholders throughout the past summer. And so I'm wondering if this was one of the issues that was discussed, and if it really has been, while it may not have been vetted in Representative Mullery's committee, that it has been vetted through the providers prior to coming to the table. I don't know if that's true or not on this particular issue that you brought up, but it is on some of the others. Could you address that?
Yes, Madam Chair. Over the course of the past summer, there were a number of stakeholder meetings held throughout the state, both with child care providers as well as parents. And as you may know, the provisions here were precipitated by the review of 83 or 86 deaths that occurred in family child care over the past 10 years. And we saw a spike in increase of deaths over the past 5 years. Many of these were preventable deaths. We often hear the term sudden infant death or SIDS. These were not SIDS cases. And so the Mortality Review Committee convened and made a series of recommendations, not all of which are included in the bill. That became a starting conversation with people throughout the state. And so the recommendations that you have before you are based on those conversations. There were some amendments made in the Senate a couple of weeks ago. Jerry and his staff are in fact meeting with providers and some of the stakeholders, I believe, this afternoon yet. They're continuing to work together to try to work through these issues.
Was it Representative Moran or Representative Fritz?
Well, thank you, Madam Chair. And so I just want to say, in regards to the sleep, that was vetted in the early childhood and youth development and was passed out of that committee.
Thank you. Representative Fritz, did you have anything to add?
Thank you, Madam Chair. Well, this is specifically why I had the bill that is just specifies the sleep position only, because of the task force and the meetings and the articles and the 30-some recommendations, I think, and I believe a dozen of those dealt with the sleep position of the infant. So that is why, and this is why I chose to vet that in this committee, so that we could get something done on that particular issue. So, and if there are all of the other recommendations that, and if they're continuing, and I'm glad to hear that they are continuing to work with the providers that we all will be hearing from, and if you haven't already, and should be, that I think we are still in the process of working on the other issues that concern our infants in their safety. But the issue that I had primarily was because I did not want it to get lost, and I wanted it to get enacted upon. So,
Thank you, Representative Fritz.
And
Well,
Madam Chair and members, again, Jerry Kerber will be before this committee to talk
On Friday.
about
Yeah, I appreciate that. Representative Abel, you're going to fill every moment until 11:30? Just teasing.
So little committee and so much time, Madam Chair. But I just do want to remind you that this is the very kind of, I mean, I don't want to, I understand the problem. The tragic deaths of these kids who go to a daycare in a house or wherever is like terrible. I can't imagine the pain of that. And I'm all for repairing it, but I'm just telling you that Representative Fritz alluded to it. Some of the points that came out were not consensus points from the people who actually have to do this stuff. And I just, as fairness to the people that are the licensed homes and the others who have not had their chance to testify about this I mean, it's going to happen here then. They're going to have to call me now. And I don't want them all to call me, Madam Chair. But I'm going to go back to my earlier recommendation that Representative Muller convene a little committee of all these things, the things that have not been addressed, and then you'll be covered and there will have been a chance for process. That's all. I'll stop now, Madam.
Thank you. No, and I think they're important points, and I appreciate Representative Fritz's comments as to why she did move that particular issue forward. And I participated in some of those community setting discussions and know that there was controversy over the original proposal, and that I know my providers in my area felt quite listened to and appreciated, and I hope the things that are being brought forward are part of that consensus rather than surprises to them as we move ahead. But I think we do have Friday members to talk to Jerry Kerber, and hopefully you'll take that opportunity. It looks like everyone's hands are now down, and so as is very unusual in this committee, we are going to adjourn early, but I do need to remind you that it is not adjournment, it is recess, and we are reconvening, and no groaning, we are reconvening at 6 p.m. in room 5. So put that on your calendars, and we'll see you this evening. Keep your paper, put it in your safe folder, please. You don't have to carry it around. And with that, this meeting is adjourned. We're in recess.